Thank you, Mr. Chairman, and thank you very much for having this hearing you and the rest of the leadership on both sides. This is so important. To you all, we appreciate you being here. All of you all have just sterling, excellent reputations, and we appreciate the fact that you're working very, very hard to keep us safe. From what I've read and from the testimony, it seems like speed's important, education's important, coordination's important. We've got the CDC involved, we've got the NIH, we've got the DOD, we've got the Department of State. Samantha Powers is calling the Security Council for the first time ever an event like this. I would like to get into a little deeper. We heard that USAID was distributing stuff over there. Who's in charge of all of that at the Washington level? Who's taking this on so that we can get coordination, so we can get speed, and get the education component done? Is that CDC? Are you doing that, Ms. Bell, or Dr. Bell? I'm sorry.
That's okay. We at CDC have the lead on the public health aspects of the response. The DOD and USAID have the lead on logistics and materiel. The National Security Council is coordinating, certainly from Washington, and it's really important that we draw on all of our assets from all of the different agencies working in our particular lanes and coordinating, as I say, all together. There is very strong interagency coordination. As I say, the NSC is deeply involved in bringing all the agencies together. And we at CDC, as I say, take the lead in the public health aspect.
Good. Well, I hope we get that worked out where, we actually have somebody that we can point to and, an individual that's kind of in charge of coordinating, because the same thing that's going on the ground that needs to be going on over there is simply not going to happen without that happening here. One thing that's happened, Dr. Bell, Dr. Fauci, there's an Ebola outbreak going on in the Democratic Republic of Congo. Is that related to this, or is this a whole separate thing that we've seen in the past?
I'll say something I'm sure Dr. Fauci can add. This outbreak is not related to what we're seeing in West Africa. As you say, Senator, this area of DRC is an area in which we've seen many Ebola outbreaks in the past, and this outbreak is of the strain that's quite similar to those outbreaks. So while we are taking it very seriously, and actually we CDC have sent a team into that area, we don't think that outbreak is at all connected. We're actually, I think, aware of the individual case that began that outbreak and had no relationship to what's been going on in West Africa.
You can actually, and I agree with Dr. Bell, that will be determined. It does not look like it's the same. The extraordinary ability to do rapid deep sequencing of the genome of these viruses can actually pinpoint whether or not they're related. And it's very interesting that the study that was done and published very recently showed the exact point introduction of what we're seeing in West Africa and how it went from Guinea to Sierra Leone to Liberia. And it doesn't look like the strain that is in the Democratic Republic of the Congo is in that lineage, even though it's the same general strain.
Very good. Dr. Bell, can you reassure I know the public is concerned about bringing it into the country. Can you talk to us a little bit about the steps with helping those that are at the airports and identifying people that possibly have the virus?
Yes, Senator. It's certainly quite understandable why people would be concerned. The images that we're seeing are quite alarming. As you note, we have been working with in the countries to improve their abilities to do exit screening. We have teams in each of the countries, and we've really been able to help them improve their capability to do exit screening considerably over the last month or so, and are quite pleased with the progress in these countries. They have equipment, they understand what they're supposed to do, they have the protocols in place, and they're really moving forward. In addition, I'll mention that we also have been doing a lot of work with our own border agencies, so with the TSA and with the CBP, to train them so that they understand what to look for and they understand when they need to call on us. As you know, CDC has quarantine stations in the major airports around the country so that they also are sensitized to what needs to be done. And then the final point I guess I would make on this topic, to Senator Casey's point, is that we've done a lot of work here in the United States with healthcare providers, even with just citizens, so that they know what to look for, to remember to ask for a travel history. There are a number of our laboratory response network laboratories around the country who now have the capacity to test for Ebola. And then the healthcare facilities themselves are very tuned into the appropriate isolation methods that would be needed should they have a suspect Ebola patient.
Thank you, Mr. Chairman.